Los Angeles right now is recommending face masks be worn in public, and some people are reposting flyers from the 1918 flu pandemic when people in California were told to wear masks. I want to get your thoughts on this debate.
The human cough contains a lot of droplets, some as large as 10 microns, but some as low as 1 micron. Now, of course, you're not going to be able to catch filter the small droplets with the homemade mask, but it still reduced some of the large droplets. So there is some sense in having at least some sort of mask covering yourself. And we want to stress that we do want to save the N95 respirators for our healthcare workers, because they're really going very close to very sick patients, doing procedures where respiratory droplets are aerosolized in the air, and they're at a high risk of getting infected. But yes, masks may be the way to go. And I see now in Texas that some areas are also starting to using the masks as well.
And when you talk about some of these do-it-yourself masks, are you talking about scarves or bandanas, as perhaps the president suggested?
Well, the material in this study was a terry cloth material. It was actually used for filtering tea. So it has to be a specific material. It's very hard to say. Scarves could be made out of cotton, out of, thick fabric. I would say the thicker the barrier, the more likely it is to be more useful.
And Dr. Ali, as the days go on, we're learning a lot more about the coronavirus. We've been hearing that people with underlying conditions are most at risk of getting in trouble. But new figures out today show that as many as 76% of the people that are hospitalized in LA County have no underlying conditions. Is that number shocking to you at all? Because it seems to be a shocking number that otherwise healthy people are requiring hospitalization.
Right. It really is shocking. We do have solid data from China and Italy that elderly and those with pre-existing conditions are definitely at a higher risk of dying. But now we're seeing people being hospitalized with severe cases of COVID who are much younger. And the only theory I have right now, because I don't have all the data to make a definitive answer about why this is that, young, healthy immune systems can be triggered by this virus and can cause an inflammatory cascade. They can become overactive. And, we really want an immune system to defend ourselves, but it also can cause inflammation and cause constriction of the airways in the lungs. And that could be the explanation of why these people need to be hospitalized, because their immune systems are so healthy that they're actually overacting, reacting really violently to this virus.
These days, a lot of the times that people leave their houses to go to the grocery store. So as you can imagine, there are a lot of concerns about how people can protect themselves. What is the school of thought on that? What should you do once you go to the grocery store and as soon as you bring the items home?
We don't have control over everything. So it's not unreasonable to wipe down some of the items that you get, because we do know that viral particles do stay on non-porous surfaces. Now, I do want to say that even in the video it was told that you can't get the virus from ingesting things. It's not through the gastrointestinal route. But still, it makes sense to wash produce anyway.
Dr. Ali, always so informative. And so what I'm getting from this, a lot of back and forth. It will be an ongoing debate, but he made a great point. As long as you're not hoarding these N95 masks that are for medical workers, it doesn't hurt. Why not grab one?
There you go.